I am really pleased to have the opportunity also to talk to you about universal health coverage, leveraging it to advance to a rare disease policy. Sorry, I have to diminish this. So what is universal health coverage? We're all talking about it now, obviously, from the point of view of the WHO, which has been dealing with the universal health coverage for a number of decades now. It has some very important principles. Everybody receives quality health services that are needed without financial hardship, which is critical. It includes the promotion, prevention, rehabilitation, and palliative care and treatment, so not just care at the point of a disease. And it includes, importantly, access to essential, safe, affordable, effective, and quality medicines and vaccines. So that's kind of what the WHO has been working with in terms of universal health coverage. And then moving into more recently with the UN taking it up, but also part and parcel of what universal health coverage is, it's at a systems level, very important to understand. It means that the health systems have to be accountable, integrated, community-based, people-centered. It means that there has to be a competent health workforce. It means that there has to be adequate health infrastructure. And certainly, to supporting all of that, we have to have the right legislative and regulatory frameworks. And I think, as we all know, very importantly, that it means it has to be sufficient and sustainable funding. So it is not just getting the access, but it's addressing what has to happen at a system level at every single country. And importantly, and I think this has become much more for us as well, it is based on the principles. And these are just a few of the words that I pulled out to talk about it. It's equity. It's based on a principle of social justice, so that everybody, regardless of where they are in the world, but also in their own country, their own economic systems, and it's the elimination of discrimination and stigma based on many, many parameters, but also obviously rare diseases. Next slide, please. So here's an opportunity for you to take polls. Hopefully we've set up to be able to take a poll. Okay, so you've got an opportunity to say the status of universal health coverage and rare diseases in my country is: do you have good universal health coverage for common conditions and the same for rare diseases? Good for common conditions, but not the same for rare? Is it moderate for common conditions and still moderate for rare? Moderate for common conditions, but not the same for rare? Is it limited or poor for common conditions and same for rare diseases? Is it limited or poor universal health coverage for common conditions and it's even worse for rare diseases? Which one best describes the status for your country, or maybe you're not sure? And so if you can choose an answer and submit, that would be good. I may actually just do it myself. Okay, I don't think Sulani and I actually talked ahead of time how we actually get the results of that poll. So maybe we don't get them till the end. I'm not sure how we get the results to this poll. I'll move on at the moment. Oh,
would you like to share?
Yeah, great. Thank you.
Right.
I was trying to figure out what do we agree on. Okay, so this is very interesting. So for the people here, a very small percentage, less than 20%, said it's about the same and it's good. About 40%, almost 2/5 of us, said it was pretty good for common conditions, but hey, it's a little worse for our rare diseases. And then we've got other people saying it's about moderate for both common and the same for the rare diseases. Again, almost 20% that's saying it's moderate for our common, but not the same. And then we've got some that said it's limited for common and same, and limited and poor, but even worse for the common conditions. I think if we look across this, we'll see is that a lot of people do believe that we've got good or at least moderate universal health coverage, but in every single situation where people are saying we actually, in each one of those good, moderate, or poor categories, it's actually worse in most cases for people living with rare diseases. So we all know we've got a lot of work to do. So as many of you will know, we actually had the United Nations Declaration on Universal Health Coverage last year. And for us, and certainly many thanks to you, Raras and Claire, and on the NGO committee, everybody who worked toward it, the goal was to get rare diseases specifically mentioned in that Universal Health Declaration. So why, given that the WHO already had a commitment to universal health coverage, why was it felt important that the United Nations move into it? And really what was important was that it was much more than health. And it's what not only WHO recognized, all countries recognized, but the UN agreed to. That one, it had to become of the SDG 2030 goal so that we would have the aim of universal health coverage for all countries, all peoples by 2030. The goal was to halt the rising out-of-pocket health expenditures by providing greater financial risk protection. So we need to bring in other financial mechanisms. We had to bring in financial agencies, including the World Bank, to help bolster countries to ensure that they can actually get to universal health coverage, coming back to sufficient and sustainable funding. That UHC has to be fit to specific national needs while increasing the outlays for stronger health systems. So it's got to be customized. It's not one size fits all. It's not going to look the same in all countries, but in every single case, we come back to the health system, the health infrastructure, the workforce have all got to be strengthened. And it has to include all levels of policy making. Again, why the United Nations? The governments have to take a role. It cannot be left to the health systems. It cannot be left to the voluntary sector. It is, in fact, important that there's a multilateral system, and across countries, there has to be existing agreement. So this was very important. And the UN, then making that declaration, brings in many other agencies. It also commits, very importantly, countries to act. And it really commits, as part of what we were pushing for in many of the articles there, to serving at-risk, underserved groups. And for us, this was key for us, that it would strengthen the efforts to address rare diseases and neglected tropical diseases. A huge victory for a very small line, but it means for us, hopefully, the opportunity to make sure rare diseases then is included, and that we move in every single one of those categories. As we're moving up in universal health coverage, we're also seeing the coverage and the support for those with rare diseases at that same level. We all need to aspire to where a very few say there are right now, and that is we have good UHC for common conditions, and it's the same for rare diseases. And of course, it also included, which includes our people with rare diseases, increased access to health services for all persons with disabilities, truly leaving no one behind. Next slide, please. So how do we get there? And it was, I think, you know, we get to one line in a United Nations Declaration, but obviously, and many of you were part of this Odyssey with us to getting rare diseases in UHC, and just want to pay tribute to the tremendous amount of work that was done, both, you know, very publicly, but also very much behind the scenes, both at, as we say, at a very top level, and certainly for all of you that participated at a bottom up level, and then bringing in many other line interests. So lots of discussions with UN officials, and I give full credit to people like Jan and Paloma and Clara, who really made an effort to go out to speak to the heads of state, the WHO officials, the state permanent missions. There were many meetings that took place, and also many of you as volunteers who came along on those, and also connected with your own governments to actually encourage the inclusion of rare diseases there. That part was extremely important, that we had the support from top down. Bottom up, obviously, the patient advocacy organizations, the rare disease patient advocates, the friends of UHC at many levels, including those within the UN. Bringing in what we call the aligned interest, the International Disabilities Alliance. That was huge support, and certainly very early on when we were part of that disabilities coalition has helped us tremendously, and hopefully also paying back into disabilities, Human Rights Council, and the work that we did in setting up the NGO committee on rare diseases, and being able to introduce rare diseases into the UN through that collaboration. And also then recognizing, again, you know, when I say, you know, sideways there, the mutual interest. You can't do it alone. You got to have friends. The Non-Communicable Disease Alliance, IFBMA, Médecins Sans Frontières, the LGBTQ or LGBTI collaboration coordination movement there, the Institute for Aging, a lot of meetings to have support from all of the other kinds of alliances that are part of the UN to help raise the importance of rare diseases as a specific designated entity there. Next slide, please. So on with that roadmap, we really did try to learn from others who traveled before us, and huge thanks also to all of these groups that when we reached out and say, hey, how did you do it? How did you get there? These are some of the groups that came forth that we became members of, that we worked with to understand what their path was, how did we get there? We created, and we really did involve many of you to leverage the opportunities, having the events, and some of you were there, were part of it, participating, supporting us in doing this. NGO Committee, International Universal Health Coverage Day at the United Nations, where we were the only patient organization that got to speak. The Rare Disease Day at the UN, that was an absolutely fabulous event. Again, for those of you who made that journey, who were part of us there, the first time we actually had a rare disease event inside the United Nations of that nature. And at the World Health Assembly again, the first time we actually had an official side event within the World Health Assembly, and also an unofficial event outside with one single goal, and that is to get that statement within the UN Universal Health Coverage Declaration when it was voted in September 2019. Next slide. So these are some of the key people that helped us, and I think I won't belabor it, but as you know, Helen Clark, who's the first UN person who actually stepped up and made that statement, and it's still a strong statement. You know, if we don't meet the needs of those with rare diseases, no country can claim we've got universal health care, and that's a big goal yet, because we know in many countries it's not the case. Dr. Tedros, who was so instrumental in giving us that strong support and who opened up for us the real hope that we were going to be able to be really very much included in universal health coverage. And of course, our very, very good friend, Rudiger Craig, who's continued to be a friend and is still working with us along the way. Next slide. Again, more very high level supports for us from Andrew Gilmore, who many of us will know has been instrumental in terms of speaking up on the rights of people with all kinds of stigma, but has been very good supporter for us. Access to quality health services, medicines, especially for people with rare diseases, from the ambassador of Thailand, who was the co-facilitator for the UHC very early on, pledging support for us. And of course, from the Deputy Permanent Minister of Japan to the UN, again, had some very good meetings with them. These were two key countries because of their leading role in universal health coverage. Next slide, please. And also empowering the patient community could not have happened if, you know, the people in the in different countries did not actually go and speak to their members. As we all know, the WHO as well as the UN is really driven by their member states, driven by their members. The rest of us can actually do the advocacy, but the actual people that can make it happen are those people that are the members. And we were really pleased that having a paper that we could share with you, a very hard I think research piece, but also then a much smaller piece that hope that many of you were able to take as part of our toolkit to go and talk to your countries. And we're truly grateful, every single one of these national alliances that you went to visit, who then came up and spoke on our behalf. That was a huge asset in terms of our being able to get that rare diseases into that statement. Next slide, please. And so this just gives you a little bit of a timeline of the map that we went through. It was a huge odyssey, and one that I think every step along the way, we felt that we were on the path and we were all very committed to it. But good gosh, I think none of us felt until that very last minute, well, probably not at the very last minute in September. I think we had some assurances. We saw the early drafts that it was going to be in there, but certainly not much before that. The recognition that, okay, this was a huge journey. And again, I'd like to really give credit to our policy folks, Jan and Claire Evans, who really, I think, continue to work tirelessly in terms of meeting people in the very, very long hours in which they put into making sure that that stays in place. And very recently, we'll have an opportunity to work even more collaboratively on that because Rare Diseases International has now been accepted as a member of UHC 2030. It gives us an opportunity to work with others toward that common goal, but hopefully also to make sure that the rare diseases are well recognized as everybody moves forward in terms of their implementation of UHC in their respective countries. Next. So here's another poll for you. Okay, inclusion of rare diseases in the UN Declaration on Universal Health Coverage helps me advocate more effectively for rare disease services and policy. What do you think? Does this help you? Strongly agree, neither agree nor disagree, strongly disagree. You don't have to know exactly how you're going to do it. We kind of want to know your emotional response to this. Is it this going to help you? How do you feel?
Okay, Dion, I'm sharing the results.
Hey, okay. So almost 60%. So this is good. You know, I believe that I'm going to be able to use it strongly. Another third says agree. And a few of you are sitting on the fence, maybe because you're not real sure in terms of how you're going to work. And there are some of you who disagree or strongly disagree. And we do know that it's a big pull, and you know, even getting universal health coverage may in fact be important. And I will tell you quite frankly, it is just words. So it is the case. It's not going to help you at all if we don't have a toolkit for how to do it. It's not going to help you at all if you're not going to be able to, you know, actually advance and be active in it. So it is very true. It is not there just for the taking. It's not just there because it's there, and therefore you can expect that rare diseases, it is going to be included in universal health coverage in your country. It is in fact a long, hard pull, even for those of us who are very fortunate to be in countries where we have very good universal health coverage systems. Getting rare diseases in there, having it as part of the UN Declaration is really just a tiny little lever, but it hopefully is a pull for us. Next slide, please. Next slide. Okay, sorry. So this is just a few of the things that we said. I'm not going to belabor it. You'll have the slides later. You can take a look at it. You know, what are the ways in which you might use it? Part of a Bill of Rights, using multiple media methods, aligning with rights-based groups in your own country, in your own environment, inviting local and regional WHO representatives to your events, and they are in fact available, including other populations in rare disease actions. And that for me has been a huge part. Who else is affected? Who else, you know, is in that situation, whether it's under disabilities or people that are struggling with access to basic care? Can we expand the movement? And we're getting more people that are asking us, I know, as rare diseases, how can we be part of what you're doing? Because we think you'll give us a leg up. So that's important. Next. So rare disease. So this is our commitment in terms of UHC 2030. It is both two-way street there. It's a commitment for us to be part of a global movement to help build stronger health systems for universal health coverage. It is also an opportunity for us to make sure that in each one of these key asks that you see here, that rare diseases has a part. But it does mean that we have to show up. We have to be there as part of it. So it's the opportunity, but it also means that we have to also do the hard work, make the commitment. Somebody sent in through the chat, and I thought it was very important. Yeah, let's not forget the schools. The schools are a huge place in which we can, you know, take advantage of having rare diseases become equally addressed. It's not just health, it's schools, somewhat in the workplace as well. Thanks very much for that comment. And next slide. So these are some of the other things that are happening in terms of the UN. The UN actually made a comment, and I just included this because we're going to have the COVID discussion later on. The UN had actually presaged certainly COVID-19, but also because there have been so many pandemics, epidemics before, and they say there are going to be complex emergencies that will likely hinder UHC. It will throw us off course, or it will try to throw us off course. And in the declaration as well, there is the need for coherent and inclusive approaches to safeguard UHC in emergency. So we do not give up on UHC, even though we're in the face of an emergency, and we need to ensure the continuum and provision of essential health services and public health functions. So again, we're all really, caught up in COVID, and we need to be, but we cannot abandon what the needs of people with other conditions and the need for continuing to move forward on universal health coverage. The UHC 2030 recent statement said, faced by the COVID-19 crisis, it is crucial that world leaders remember their universal health coverage commitments. And we do know that this is in fact the bigger umbrella, but also we cannot give up on the progress that universal health coverage helps us is making in terms of dealing with all kinds of health conditions. And the WHO coronavirus guidance, just putting in there again, maintaining essential health service. And this is what we're all dealing, right? We've got the balance, we've got demands of responding directly to COVID-19, but we also have to make sure that our health service delivery, the risk system does not collapse. It's always a balance. I know all of us are hearing a lot about the concerns about the balance between economics and opening up the workplace and safe and healthy, but also within health, we need to be concerned about the balance. And this is not being selfish. It is taking that big picture, which universal health coverage helps us to do. Next slide, please. And this is your last poll. I would be interested in having tools and training on how to leverage UHC to advocate for rare diseases. And this is really to us as RDI. What do you think? Do you want to need to have this? Would that be something that you would take part in? Some of you have heard our work plans when at the AGM, and we are moving forward to looking at what we need to do. Okay, oh, well, that's good. Okay, 70% strongly agree, 25% said I would agree, and only a very few of you says I'm not real sure. So I think this does give us some real strength in terms and the motivation to move forward in terms of how are we going to do that. And definitely it's part of our work plan for RDI for the year. That's it. Thank you very, very much. I don't think we're going to do questions right now, are we? I'm sorry, I'm not real sure.
Now let's keep the questions for the end of the session.
Okay.
So Alba, can you share your presentation with us, or would you like me to do it? Alba? Oh, there you are. Okay.
No, I think I can do it.
Okay, yes. Great. So let's leave questions for Durhane and Alba at the end of the session around 2:45.
Okay. I have so many windows open that I
yeah, I know. I have that problem sometimes,
yeah.
But tell me if not, I can take over.
No, it's okay.
Okay.
Okay. Through my presentation, hi to everyone. Good morning, evening, afternoon, night, or wherever, where you are. I'm going to try to answer to Durhane's questions about how a global policy action can increase RDI members' leverage. I'm going to try to do it by presenting how we advocate in Spain for the integration of rare diseases in national policies with the framework of the universal health coverage. I must start by saying that it was not an easy task, not just a question of one day or one meeting action. It was the result of several agents working together in a very planned strategy that took almost 3 years to get results. At the beginning, we didn't even know what will be the outcomes. We just believe in a global policy and to try to include rare diseases in the UN and WHO agenda. From the first beginning, we got benefits by involving our authorities at national, regional, national, international, and global level to this global policy. And it allows us to approach our policymakers to rare diseases. We did it holding on common tools as Rare Disease Day, conferences, and we try to involve in very different actions, WHO side event, UN event, and above all, the electoral process. And to end with, I will show you how important is at a national level to work with a global strategy, also to fight against local barriers and all those difficulties countries as Spain we face with that decentralized system. So let's start with the beginning. And we participated long time ago, in November 2017, in an RDI and Raras webinar about how to put rare diseases on the United Kingdom, United Nations agenda. And we just were interested, so we received a template to send a letter of involvement to our permanent mission representative in UN and our Spanish permanent mission representative in Geneva. And it was very easy. We just have to adjust to our language and include our logo in the letter. And we had a very nice welcome. They were immediately interested in us, and they did it because we were by the hand of an international movement. First question was how many regions and how many countries we represent by the rare diseases community. And they just give us some recommendations because the agenda was very easy. We just asked how to include rare diseases in the UN agenda. We got 2 meetings, one meeting in Spain with the UN department in Spain. It was in a Spanish meeting, and we also were received in Geneva by our Spanish permanent mission representative in the WHO. This first attempt led the politicians to push us to try to include the rare diseases in the high-level meeting on NCDs. That was not finally successful, but at least they were engaged with rare diseases and they were concerned about our needs. And we also got the involvement of our Minister of International Affairs and our Secretary of Health in Spain to push rare diseases to be in the WHO Assembly. It's interesting to highlight that his declarations were to support further through the international patients movement, not just further, just do it next to RDI and other patient organizations and alliances worldwide. We also got their commitment to try to support us to have a official side event in the WHO Assembly, but it was too late. So at least this commitment got to us a high impact and an involvement for future events. These first attempts also allowed us, by the hand of Father Pov in Argentina and Oliver in South America, to be mentioned. Rare diseases were mentioned at the non-communicable diseases high-level meeting in September 2018. So they had a statement declaring their involvement also with rare diseases. And then finally, we got a real involvement of our authorities in the UN event organized by RDI and NGO committee in February 2019. after a couple of rejections, we finally got their accept and their endorsed to be part of this UN event, and they were one of the 15 countries that sponsored the UN event. That was very meaningful to us because we achieved the decision maker in charge of national strategy of rare disease in Spain was presentially way there in the UN event. They made some declaration, not very satisfying, but at least it was a base to hold on our national strategy to get that involvement with the universal health coverage. We also were there through the video of the Rare Disease Day because one Spanish testimony was in the video, and so also as it was displayed along the ceremony, it was a way to participate of this UN event, and for sure further joint event, and we were there. But this UN meeting sponsoring was not the only achievement we get. Also, by supporting a meeting between our Spanish permanent mission representative in UN and Durhane, Jan, Claudia, and Clara, we encourage a reception from our Spanish ambassador the day before of the UN event. And that was apart from a point to have a meeting and to network with other alliances and other participants in the UN event. It was a chance to have a face-to-face meeting with our decision maker representative, but also to get a strong commitment from Spain, because if the ambassador was receiving rare diseases patient organization representative in his house, that means Spain is really engaged with rare diseases and the national strategy. Next step was the Rare Disease Day in 2019. Rare Disease Day, we based on the Sustainable Development Goals, our position paper, and that was very useful to us, not only to gather and raise awareness on the Rare Disease Day and rare diseases, but also to work on what will be the future conference, what we call Global Challenge and Holistic Challenge Conference. It was a good practices change at international level. Many of you today were represented there. We had the chance to have there Peru, Uruguay, Luxembourg, also AFM Teleton, Frambu, for sure Paloma, presenting the importance of the universal health coverage. All of them showed to our queen and to our policy makers different landscape, different initiatives, and different level of achievements in terms of rare diseases policies. And that was very good to give a whole view of what's going on all over the globe, and to get a commitment from our governments, not only at national, but also at international level. And finally become the electoral process. In fact, we had 3 electoral processes along the last 2 years, also at national and regional level. And we base our electoral process strategy on the words our president, Pedro Sanchez, said at Universal Health in New York, September 2019. His words severed that the basis of our national strategy for health was the universal health coverage, and that was the way we commit them. And then we present to every political party our recommendations to include in their electoral programs rare diseases based on the Sustainable the development goals and also universal health coverage. Sustainable developmental goals was also very, very useful to us to raise funds, because our public funds and call projects at governmental and public level are very committed with sustainable goals. It's a commitment with rare diseases. They included in their roadmap rare diseases inside of the universal health coverage strategy. And that was one of our main achievements and our main goals through all this strategy. But I cannot forget about the cohesion that international policies and international movement gets inside of Spain. Because since the beginning, European recommendations help us to promote national policies on rare diseases. As many of you know, Spain system is a decentralized system. We have 17 health systems, 17 regions, and that's not very convenient for rare diseases and for healthcare. But when they speak in terms of ERN or in terms of international collaboration, they are ready to work together. So this is very encouraging and very useful to us, because they think in terms of international, not in terms of region or in terms of nation. In a resume, this international action and global strategy support us to get policies at regional, national, and also international level. Also positions FEDER and patient organization in a much stronger situation, because we are not just a national patient organization, we are an international patient organization, and also gives us chances basing our advocacy strategy on the international strategy. I want to encourage you to take the chance. Now RDI is working on that universal health coverage toolkit. I want you to tell you, please give it a try, and if I can be useful or supportive by my experience, please contact me. I will always at your disposal, and thanks very much for your attention. Any question, please go on.
Thank you so very much, Alba. That was amazing content, but also an amazing presentation. And certainly we recognize by the kind of commitment and the emotion that you put into it, that this is something that you carry forth, certainly not as a piece of work, but as a passion. So thank you so very much. And I can tell you honestly, Alba means it when she says, if you need any help, reach out to her. She is really there, ready to help. I know that last year she came to the Asia Pacific Alliance of Rare Disease Organizations, came in to help share her experience. And I know I speak on behalf of Rito as well. It was a huge asset to have Alba there to share what they've been able to do, not only in Spain, but in Alibert as well. So we know that you mean it when you say you're there to help, and always are open to the support, but also, as you say, taking from others. Okay, are there any questions that anybody has? One of the questions is, will we be making the slides available? I presume that's yes. That the slides will be.
Yes, the slides will be available. So will the presentation on our website in the next couple of days.
Excellent. Okay. Anything else? Okay, there's a raised hand here from Yasser. Can we have, I suppose, Is there a way to unmute the screen, or can you put in your question here? Now, Alba, I know that you started way before the UN Declaration, and you were very much a part and parcel of it. Was there, has there been any opportunity for you now that it's actually been in the UN Declaration to think about any further usage that you can have in terms of that as part of universal health coverage? Are there any plans that you've got within FEDER, or maybe even with Alba? I know you've got a tremendous role in Alba. Are there plans or opportunities that you can see how we might better leverage the rare diseases there
right
now?
We are, I think, as everyone with the COVID crisis, we are a little stuck, and we are just waiting some time to start again with our advocacy action. But I'm sure also RDI will give us new chances with the toolkit, and we could start again and reinforce our previous action.
Well, I really echo what you're saying. I think we're all feeling a little positive. I'm hoping that, we're going to kick off the session later on today with the COVID-19, but I think that the UN, premonition that, we'll have emergencies. This will not be the last possible, epidemic or something else that could possibly derail UHC and especially rare diseases. So I think for us, as you're saying, it's a huge question of how do we actually continue forward, with rare diseases, with UHC, even in the face of these epidemics, or there's some better opportunities. So we'll be opening up that discussion. Hear what you're saying very much, though. There's a question here. To you, Alba, from Victoria Headley. She says, if you were to do this again, what single thing would you do differently, if anything? And by the way, it's great work as always, she says.
Wow, it's an interesting and challenging question. Just let me think about it for a second. I will have a clearer roadmap, because at the beginning, we really didn't know what we were aiming. We just wanted to include rare diseases in the UN agenda. Now we know that the good way is universal health coverage, but at the beginning we had a couple of non-successful attempts, as for example the non-communicable diseases, and that made us to lose some time, because we were like a little lost, and we didn't put all the efforts on the mainstream. And I think right now we have a clearer roadmap, so we can work better on that. And maybe we should have planned better our action, not to be so just give it to try. That right now I think it's going to be easier, but maybe was one of the things I would have done different. Yeah.
Okay, so rather than being just opportunistic and as things come up, try to be a bit more strategic. But hey, you know what? That's always easier to think about after the fact, right? I'm not so sure. Okay, let me try again with Yasser. Yasser, can you? I see you're unmuted. Can you speak or ask your question?
Do you hear me?
Now we hear you. Yes, please.
Thank you. This is Farias from Rare Diseases Foundation of Iran. Unfortunately, my ID was not working, and I'm talking on behalf of RD. Hello to everyone. Congratulations on your achievements. And the question is that we are very happy that rare diseases are going to be included in UHC, and there is going to be new plans and policies in this regard, and we hope that there will be some considerations regarding especially our country. We have sent messages to you all, and of course we have participated in the declaration, and we hand it to our MOH and the representative mission in New York, that we all agree to UHC. And we hope that it will work, especially in Iran, with no support. And we expect you all, our dearest colleagues, to help us with the issue, to see how we can bypass the sanctions to get more support accordingly. Thank you. I'm not going to take your time too much, and I congratulate Alba because I visited her in Madrid for the session we had on our first atlas for rare diseases in Iran. And I hope that we can participate in your collaborations furthermore, more than before. Thank you all.
Thank you so very much for your comments. We know that, you know, in many cases, it's so much more difficult with everything else that's happening, but we've all I think, are committed to, you know, rare diseases, and certainly health and rare diseases, including, you know, it should not be subject to the politics, and definitely know that we're proud to have Iran as part of RDI, and we're really committed to working as much with you as possible, and definitely appreciate your sharing the updates that you've got. We're going to run tight on time. We ran a little bit late, so I'm a little bit concerned about opening up the mic. So we do have a couple of questions that I might kind of get to kind of quickly. I know that you know, we have a number of concerns here. I think Tony had a very interesting comment that I wanted to bring back. He says he's concerned that, Tony Holland, that UHC is defined too narrowly. And for many people with rare disorders, the solution may or may not be medication, but rather good quality care, the availability of reliable information, access to skilled surgery, et cetera, et cetera. How do we advocate for these? And those are hugely important. And I think, as you saw with the WHO definition of UHC, but even more so under the UN, that UHC includes so much more than medication, includes so much more than just healthcare, but really is embedded in good quality care, as you say, but also all the other aspects, including communications, information, etc. So I think it's a good reminder to all of us that when we're advocating for UHC, and certainly for the inclusion of rare diseases, yes, we can get fairly narrow caught up in terms of diagnosis or treatment or access to specialists, but really all the other components of it are hugely important, including mental health, including the issues of stigma. So it's it is built in. It's really clearly outlined in both the WHO and the UN Declaration, but so it's up to us to pull on those. But it really, and I think we've seen in many countries where some very comprehensive programs. I point to Taiwan, where their program is really based on a lot of components, including support for social services, including access to quality schools, education, etc., as education and as part of it. So I think this is indeed, you know, really an important component of it. Okay, Toon, I'm going to see if I can squeeze you in for one question, if you can do it quickly.
Can you hear me?
We can hear you.
Great. Thanks for all the great presentations and efforts and including obviously rare diseases into this resolution. I had a follow-up question to Alba, especially kind of what it means locally. Can you extend a little bit kind of what you have seen as the extra opportunity with this universal health coverage resolution on top of what we've seen in Europe already over a number of years in terms of efforts of countries adopting national rare disease plans? What has been a different element for you that you could have leveraged as part of your efforts?
Our president was in the high-level meeting on universal health coverage. It's very common that our politicians, our authorities go to this kind of meetings, it's international meetings, and they show their support. And we use that declaration to base our strategy. And it was true that it wasn't the very first time we mentioned the universal coverage. We had been mentioned universal health coverage and rare diseases at UN agenda since 2 years ago. So it was not new for them, but it is true that we take the chance, we take advantage of their polite implication in universal health coverage to say, so if you are involved with universal health coverage, now we want you to give us a feedback. I want you to know how are you going to include rare diseases and how you are going to to leave no one behind. Also, we complement with the action made before because some of our Ministry of Health departments were involved in the UN event. So if they were in the UN event and in supporting rare diseases, and they also support universal health coverage,